So now you have been given a date for cataract surgery or any type of eye surgery. So before you come to this hospital for eye surgery, there are some things you need to do at home. The most important thing is to have a proper head bath. Why head bath? You can be taking a head bath in the morning of the surgery or the previous day. It is very important because you may not be able to take head bath for the next 3 days or 1 week depending on the type of surgery. So that is most important, that you do the head bath before you come to the hospital. The second thing is, ladies especially, if you are wearing eye shades or eye mascara, you should not wear that before an eye surgery. The third thing to remember is, if you are having dentures like false teeth or dentures that can be removed, we will ask you to remove those dentures before you enter the theatre. So it is very important that you bring the container of the denture to the hospital with you. The most important thing that people always forget is that they don't have a proper breakfast. Why don't they have a proper breakfast? Because they are afraid or they are tensed and they say that less food is enough for them. The danger to that is, once you enter the OT, it is a stressful situation. And there is every chance that the sugar might go down. To prevent such a problem, it is better that you have a proper breakfast and take all the normal medications. The BP medications, the diabetes medication, and whatever medications you have for, suppose for asthma or you're taking an inhaler, especially inhalers, you should take that before you come to the hospital. And it is very essential that you bring all your medicines, whatever you are having in the morning, afternoon or the night, with you to the hospital so that we know exactly what medicines you are taking. Suppose we need to give some extra medicines because your BP went up, we need to know what medicines you are taking. The other thing that people need to remember is, whatever ornaments you are wearing, suppose you are wearing a necklace or a finger ring or a bracelet, you must remove that, leave it at home, then only come to the operation theatre. And ladies especially, I've seen many patients wear their nail polish and come to the theatre. Remember, we're not going for any competition or anything. We are going to put a machine called a pulse oximeter on your finger to record your heart rate and your oxygen saturation level. It is very important for us to monitor that during the surgery. And if you're wearing a nail polish, that will give a very wrong reading. So it is important to remember to remove your nail polish before you come to the any hospital for an eye surgery. For gentlemen especially, it is very critical that you're in the habit of shaving. You shave and come for the surgery, either the previous day or in the morning of surgery. Because after surgery, we might advise you not to shave for 2 or 3 days. Not because we don't want you to shave, because people are afraid of putting some water on their face after the shaving act. So generally after surgery, 3 or 4 days, you may not be able to shave. And the other thing people normally ask me is, after the surgery, how many days should we wait for before doing shaving? We generally advise 5 days to 7 days, because invariably after shaving you splash water on your face, and it is safe to do that after 5 or 7 days. The most important thing you have to remember that wear your protective eye shield, and also try to close your eye before you splash water on the face. If you do that, you're safe.